Hi, I'm Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we're going to talk about endocrine disease in cats. Endocrine diseases are disease problems that result from hormonal imbalances in the body, either an overproduction or an underproduction of hormones that are needed to do a variety of things, such as manage metabolism or help with digestion. In cats, the two most common endocrine diseases we see would be diabetes mellitus and hyperthyroidism. The most common clinical signs associated with diabetes in cats include increased thirst and increased urination, an increased appetite. Oftentimes owners will report that their cat is hungry all the time. Sometimes they'll report that their cat is ravenous. And then the third big problem that I commonly see would be weight loss. Despite the fact that the cat is eating more, they're losing weight. So chronic insidious weight loss in the face of a robust appetite is always a hallmark sign of a problem. Diabetes is actually a relatively easy endocrine disease to diagnose, and it's diagnosed with basic blood work. And we need what we consider a minimum database would include a complete blood count, which allows us to look at the cat's immune system, a complete chemistry panel, which allows us to look at the cat's organ function and electrolyte balance or imbalance. And then lastly, we like to pair that with a urinalysis and a check of the thyroid function. And most of the time, we're able to diagnose diabetes with just that minimum database of blood work and a urinalysis. Hyperthyroidism is also an extremely common endocrine disease we see in cats. And that results from an overproduction of thyroid hormone, which results in the cat's metabolism speeding up to really, really fast levels. And while at face value that might seem like a good idea, well, if my cat's metabolism is running really high, then they're able to stay nice and lean. The problem is that metabolism is so fast that it results in illness because the cat cannot physically consume enough food over the course of a day's time in order to keep up with the metabolic rate with which the food and the calories are being burned off. The most common clinical signs associated with hyperthyroidism in cats would be chronic and insidious weight loss, despite the fact that the cat is eating, again, very well or even ravenously. Other common clinical signs associated with hyperthyroidism would include vomiting, diarrhea, a lackluster hair coat, and they just kind of get somewhat of a scurfy and unkempt appearance. Those would probably be the most common signs. I would say that also increased thirst and urination are oftentimes seen or reported as well for most owners, and that's because unfortunately many times cats who are having hyperthyroidism are also suffering from some degree of kidney disease, chronic kidney disease as well. Although, to be clear, kidney disease is not necessarily considered an endocrine disease in cats or dogs. Hyperthyroidism, like diabetes mellitus, is a relatively easy diagnosis to make. Like diabetes, hyperthyroidism is diagnosed with basic blood work. Again, I would run a complete blood count, or what we call a CBC, which lets me look at the cat's immune system. I would also run a full chemistry panel, which would allow me to look at the cat's organ function and electrolyte balance or imbalance. And then lastly, a urinalysis and what we call a total T4, which the T4 is really the biggest parameter that's used to diagnose hyperthyroidism. Thanks for spending some time with us today. I hope you found this chat informative. If you have any questions, don't hesitate to reach out to us at Tuscan Ridge Animal Hospital.